Hello everybody, I'm Professor Dr. Sonia Nankani. I have been in practice for almost 23 years and I am a consulting ophthalmologist. I'm Director, Krishna Eye Centers. Today I want to discuss with you a topic which is kind of growing in India like an epidemic. So there are almost 3 billion people around the world who are using the internet, and this is almost growing at a speed of 10 to 12%. Out of these people, we have found that 50 to 70% of the people have a screen time of more than 3 hours. And those who have a screen time of over 3 hours are likely to come to our clinics complaining of redness, pain, watering, headaches, doubling of vision, difficulty to focus onto the screen, and sometimes even the inability to look into the screen. Along with this, they may have severe photophobia. Now, all of this basically contributes or is contributed by two conditions which are going on to develop in the eyes. One of them is known as the digital eye strain, and the other one is the dry eyes. Now, these are kind of intertwined, but everything is not just dry eyes here. And treating them with just plain eye drops or tear substitutes is probably not going to give us as much relief as is required. We are finding that what is going on with these patients is that they are having, or rather, they have developed binocular visual function dysfunctions, which amounts to the inability to keep focus, or rather make the eyes work together. So uniocular, when we say, is the function of one eye singularly. But God has not given us our eyes like the fish on the side of our face. We have our eyes on the front of our face. As a result, a lot of our visual functions are a result of both eyes working together. Now, these visual functions, which are known as the binocular visual functions, are basically of two types which help us to hold focus. One of them is known as convergence and the other is accommodation. Now, in computer users who are using computers for over 3 hours, they kind of develop a problem which is known as convergence insufficiency, which means they are not able to hold on to a focus clearly, and that is why it is convergence insufficiency. And the other is the inability to change focus, which is a failure of accommodation or different types of accommodative functions. The management for this is extremely simple, and it is catching up in our country now. So this can be treated without the help of really having to wear some special glasses or some surgeries or some eye drops. This, all it needs is to rebuild these two functional losses. One can just do some eye exercises and rebuild or reboot their eyes. There are certain softwares which are available in our country, and they do help in building, and one can sit at their own desk and do these exercises. They are very scientifically produced. I have been using something called as Binox for a long time now, and my results are excellent with it, and my patients go back without headaches and without eye strains, and they go back to their world, to their digital world, I would say. So that's one part of it. And the second part of it is the dry eye that develops because of infrequent blinking. And this can be treated through different mechanisms now. So there are some advanced forms of dry eye treatments besides the eye drops. One of them is with the use of some light modalities, and which is put onto the face like a mask, and some LED lights are given, and these help in expressing more tears from the eye glands. So there are these are the different ways in which we are doing it. We are trying to manage digital eye strain and dry eyes. And of course, the 20-20-20 rule does apply. The ergonomics does help. Make sure you're sitting well on your table with your computer placed at the right distance. There is proper lighting, and your chair has the perfect ergonomics. So there are a lot of things, a lot of other things that help keep looking off the screen every 20 minutes for 20 seconds, and keep your distance around 20 inches, 20 feet away. Look away at 20 feet. And so this way it does help to minimize the effects of the digital eye strain. I hope you've liked my little input in this video, and in case you want to find out more about the treatment modalities that I'm talking about, you can find me on lybrate.com. Thank you.